Psychological and behavioral problems don't just begin and end in the mind. They're complex and multifactorial, and that's why each new client admitted to Center for Discovery receives a complete evaluation of all the biological and the psychological and the social and the family and even the spiritual factors that contribute to their unique strengths and weaknesses. We want to know not only how does our client exist in and relate to the world, but how did they come to develop that particular style of living and that style of relationship, and what keeps them moving in the direction that they're moving. What motivates them and what holds them back? Because when it comes to psychological treatment, one size doesn't fit all. It's important to tailor the treatment to suit the unique needs and characteristics and personality of the individual. Just the same way that you wouldn't try to treat every broken arm with the same shape and size of cast, you custom fit the cast to the particular arm that's broken, so that the bones are enabled to grow and strengthen in the right direction for them. In just the same way that you have to look beneath the surface of a broken arm to find out what's really going on and what needs to be done, you use an X-ray. You also have to be able to see beneath what's happening on the surface when there are problems with emotional regulation, with social functioning, and with behavior. So in order to treat a wound in the body, you have to know how well the immune system is functioning. Is it deficient, leading to infection and slow healing? Or is it hyperactive, leading to excess inflammation and pain? Or is the system functioning correctly, but in the face of some environmental factors that need to be changed? The same process of understanding applies to psychological wounds as well. So often, we need to look more deeply into the internal and external factors affecting our clients. And one of the ways that we do that is by using highly advanced psychological assessment techniques that are specifically chosen to tell us about the factors relevant to what we're seeing in the client. In some cases, we need to know how the brain's information processing systems are working, whether, for example, they're expending too much energy trying to make sense out of the world, or whether they're getting caught up on irrelevant details. In other cases, the most relevant factors may be relational. What types of expectations and fears and self-fulfilling prophecies is the client bringing into the relationships in their lives? So because of that recognition, that every client really is unique in their functioning and in their capabilities and in their potentials, we maintain a large arsenal of diagnostic tools so that we can ensure that each client is receiving treatment that's specific to their unique needs. And we look forward to working with your family here at Center for Discovery.